Chapter 3, the types of nursing research. So let's start. Our objectives for this chapter is outline the main characteristic of different research design used in healthcare research, differentiate the kinds of questions that require quantitative and qualitative and mixed method designs, explain how the characteristic of a chosen research design impacts on research process, and last, evaluate the characteristics that are basis of decision or design research decisions. So let's proceed. So, may I ask you what type of research it is? Light in the midst of darkness, lived experiences of cancer warriors, the, per- the perception of nurse managers to patient safety culture and safety culture maturity level in internationally accredited hospitals in Metro Manila, a comparative study. So I want to ask you, is it applied? Is it basic? Is it non-experimental? Is it experimental? It's quanti-quali? Or it's quantitative and qualitative in research? So later in this module, you'll understand and we'll identify what specific type of research it is. Types of research in terms of purpose, nature of design, philosophy, and time. Based on the purpose, there's two. It's basic research and applied research. Nature of design is experimental and non-experimental research based on philosophies. Our paradigm, we have quantitative slash post-positivist or positivist, and the qualitative or naturalist or constructivist. In time, it's cross-sectional and longitudinal in nature. Let's start with the purpose. In basic types of research, it's finding the truth. It's generation of knowledge. No? In applied research, it's finding the solution. And there's application of knowledge. In basic research, we are more adept to the development of truth. We are seeking for the truth, such as what is the lived experiences of COVID patients? What are the experiences of healthcare staff in times of the pandemic? You find the truth behind those situations, and you generate new knowledge with that. In applied research, however, there's a solution interventions you've injected to your study, such as are there differences between the use of banana leaf to prevent bed sore, or we can use skin tightening solution and creams? Is that correlated to the decreasing incidence of hospital blood pressure injury or bed sores? And it is the application of knowledge. Some of the basic research and had been there, they had this suggestion and recommendation that can be translated to the applied research. For educate for the for the educators, it's more on the action research. Okay, so again, basic is finding the truth and applied is finding the solution. Okay, so for experimental versus non-experimental, experimental, please take note that in experimental you have that interventions. You've injected some modification, some innovation in the process. It shows the cause and effect relationship, such as the effect of banana leaf to preventing pressure ulcer. Okay, the cause and effect, the hand hygiene, the increasing hand hygiene compliance decrease the hospital acquired infection. For non-experimental, there's no interventions. However, it delved with the identification, development, description, explanation of a phenomena through what? Observation, empirical modality, and analysis. So experimental research has three components. First is randomization. Randomization is all of the population or all of the samples have equal chance to be picked as a informant or as a subject of the study. Such as if we have 100 informants, we put them, they have a code and we put them in a fishbowl and we get only 10 out of the 100%. So we get their names in the fishbowl. That's a simple random sampling. It's very randomized and there's no bias. Thus, and the other two is manipulation. Manipulation is you've added an intervention, and the control group is you don't have any intervention at all. So if you accomplish the three requirements for experimental research, it can be said that it's a true experimental research. There's three types of experimental research. We have true experiment or true experimental research. We have three components: the manipulation, the control, and the randomization. The quasi is false experimental. So we have lack of randomization. Maybe there's a purposive sampling or other sampling methods. Non-randomized sampling methods. Pre-experimental, there's no comparison between the manipulate control and experimental group. There's only post-test or pre-test. So that's pre-experimental, one of the weakest experimental research. In non-experimental research, we have different kinds. No, we have descriptive, so it includes the survey, the case study, no, the developmental research is we want to know how it got there, how the phenomenon evolved. Right? In evaluative research, there are other interventions such as the use of these compassionate drugs for COVID. However, it should be evaluated and it should be verified for effectiveness. Demonstration in the sense that in the past or in other researches, there's effective intervention. Thus, it should be demonstrated, it should be validated through research. Explanatory, such as I've already mentioned, the lived experiences of cancer patients. We explain the phenomena through narration, through observation. Problem solving and decision making. Yes, you may be confused because it is more on there's experiment to this, but problem solving and decision making, you have a pool of evidences and you analyze it. What is the top most effective problem solving strategies? And last is natural experiment. In experimental research, you've manipulated, you've injected some innovation on the practice of nursing. In a natural experiment, you observe the natural causes or the natural courses of maybe labor and delivery. What happened to the individual if the mother is in labor? So that's natural experiment. Quantity and qualitative. Quantitative, again, I want to reiterate, this is the post-positivist point of view, and the qualitative is naturalist or constructivist point of view. So for quantitative, it is more testing the theory. So in your experiences, quantitative research has this conceptual framework and also theoretical framework. For it to have a guideline in your analysis and interpretation of your data. However, in qualitative, you generate your own theory. Okay? You generate new knowledge. No? So based on the analysis, it's more statistical inside of quantitative, and the qualitative is more holistic. It's more on the thematic, it's more on the abstract part of research. Phases of quantitative research. No, we have conceptual phase, wherein one of the hardest step you'll take as a researcher, because it needs a vast readings, should have uh, that mindset of uh, don't give up, because this is you will come up with a research problem, your objectives, so, and the significance of your study. Design and planning is it's more on how we will attack your study, what methodology we'll use. Is it a quantitative or qualitative or mixed method? For empirical is how we collect data. Is it a survey? Is it a focus discussion? Or is it an interview? And for the analytic phase, it will depend on the data gathered. If it's a survey, it's more on the statistical. If it's a qualitative or interviews, more on the thematic analysis. And last is dissemination, reporting, documentation, and application of your research. The types of qualitative research are the following. Phenomenology. Phenomenology is the study of the phenomenon and or the situation itself. So, in my example, live experiences of cancer patients, we are dealing with the experiences of pediatric patient, what his or her perception towards the disease or the cancer, how he or she copes, and how he or she continue to fight this disease. So that's the phenomenon. It's the holistic approach of a situation. Ethnography, it is more in depth than phenomenology, because ethnography you submerge yourself on the situation, such as live experiences of a Badjawan community in Batangas City. So you will live by, or you will live with our participants. No? It's not only dealing with healthcare beliefs or healthcare practices, but you will be submerged in the culture of the group or specified group. Third is grounded theory. Grounded theory is your outcome is creation of your own theory based on rigorous interviews and observation, based on the interview guide that will be created, and eventually it will evolve and evolve until you saturate your data, until the truth you can consider your result as truth. Next is historical qualitative research is you do data gathering retroactively. So doing this, such as the narrations of our heroes, the narrations of our um, patients, or even our the narration and observation of the nurses in the past. So that's historical. And last is case studies. Case studies is an in-depth analysis of a patient, if it's a case study analysis, or an individual or a situation, then you should analyze it. So next is the comparative analysis of quantitative and qualitative research. As a role, preparatory and qualitative is means exploration of actors' interpretation. So in quantitative, as a researcher, you should prepare your questionnaire and disseminate it to your participants. However, in qualitative research, you should be observant. No, in qualitative research, there's a technique of triangulation. In triangulation, there's observation, there's interviewee, and there's a recorder. So there should be congruencies between the verbal and nonverbal communication, and if there's non-congruencies or incongruencies, it should be interpreted and it should be analyzed separately. So in relationship with the respondents, quantitative it's more distant, but qualitative it's more on we are close. We are close to the subject. Stance in relations to subject is outsider, the qualitative is insider. You're within the phenomenon of the subject. Here's concepts in research. Quantitative is more confirmation. You confirm or you accept, or you can also recommend, no, the additional to some components of this theory. But in qualitative, you have created a new theory or concepts. So research strategy is more structured in quantitative, and qualitative is unstructured because we have only interview guide, and through probing you will have a deeper understanding of the situation. Scope of finding is nomothetic and hagiographic. Nomothetic in terms of it can be generalized to all. However, in hagiographic, it's more on secluded to the specific groups, now, such as the cancer patients, pediatric cancers. Image of social reality, static and external factors in quantitative, because the findings will be hard truths and data and based on statistical treatments or statistical analysis. However, in qualitative, it's processual and constructed, rich and deep, because based on the my research, the live experiences, it delves with metaphorically um, analyzed themes, and it will be more impactful to the readers and the audience. Mixed methodology, it is the connection or the mixture of qualitative and quantitative research. So the core characteristics is we collect and we analyze. There's mixing and integrating or linking, no? Linking of the analysis from quanti-quali or quali-quanti. Prioritization or simultaneous. So based on your research problem, there should be prioritization if is quanti will be the first or quali, or you should do it simultaneously. Applicability in phases of research and direct the plan of research. No, there should be plan from the start if you will conduct a mixed method. When to choose a mixed method? First is one data source may be insufficient. There are times that like live experiences of HIV positive patient, you have only the narration, you have only the themes. However, how about the statistics? How about the percentage of how many uh, patient on this age group had have this positive results? So there's insufficient. Next is to further explain the initial results. Maybe we have themes of depression, fear in the live experiences of HIV patients. However, it can be validated through the use of a questionnaire from the teams on the qualitative research. So thus, the research will be more credible and the data will be more robust and the analysis is more comprehensive. To generate exploratory findings, to enhance study with the second method. You enhance, such as if you use quanti in doing your perception of nurse managers to safety culture and safety culture maturity level. So yes, you know that they have high level of safety culture. And may I ask why? So the why there could be assessed or can be collected through other methodologies of research, such as the interviews or the phenomenology technique. And to best employ theoretical stance, no? So for us to prove the claims of the theories through the use of more rigorous methodological techniques to understand a research objective through multiple research phases. Okay. Steps in conducting mixed method. First is identify the research problem. Second is determination of feasibility. So again, I want to reiterate that feasibility uh, is based on the experience of the researcher, the budget, the resources of the researcher, and the time. So all of this should be considered if you want to pursue mixed method. Third is clear and sound rationale of mixed method. As a researcher, you should be clear enough why would you choose mixed method, because it's not to complicate things, but go back to your objectives. Why do you want to have a mixed method as a research design? Next is identify mixed method design. Later we'll discuss the different types of mixed method. Develop research question for both quanti and quali. So in mixed method design, there's two separate objectives for the quanti and qualitative research. Review of literature, collect the data, analyze. Later in the analysis part, we'll discuss how will you analyze a mixed method approach. 9 is conclusion and development. And last is final research report and dissemination. These are the types of mixed method. First is the concurrent. Concurrent is quanti plus quali. Okay, quanti plus quali, it's simultaneous. How can we do it? We can disseminate a questionnaire, and on the latter part, on the other parts of your questionnaire have its open-ended question. So that's the concurrent method. Explanatory sequential. You start with a quantitative part of research, analyze it separately, then based on your statistical analysis, create or validate it through interview. So explanatory sequential. Exploratory sequential, however, is you will come up with an interview guide, and based on the themes, you will create your own standard, your own self-made questionnaire, and it will be validated. So from interview to creation of your own questionnaire. Okay. Then next is embedded. The quanti is within the quali or vice versa. So while you are doing your interview, you are also getting some data that can be statistically analyzed later. And multi-phase, after your quanti-quali, it will be again data gathered through quanti plus quali. So this is multi-phase research. Research based on time. There's only two. We have cross-sectional and longitudinal. In cross-sectional, there's only short period of time based on the observation, such as more on more on all of our research in nursing, and especially in our course, nursing research in for nursing students, are cross-sectional. You're only limited to a period of time because we don't have the luxury of time and the budget and even the efforts are very taxing. However, the longitudinal research, it takes years, 5 to 10 years. They do cross-sectional longitudinal study that it's more on prediction and control what happened to the patient or COVID patient across time. First year, second or third year, or even 10 years from now, what happened to them. So these are the difference between the cross-sectional and longitudinal. So let's check after our lecture. Now, can you outline the main characteristics of different research design? Can you now differentiate the kind of research question that requires quali, or mix? And explain how characteristics of chosen research design impacts on research process. And last, can you evaluate now the characteristics that are basis for design method or methodology decisions? So again, the lovers of research, love, stay in love, live by it, grab every opportunity, value research, and last, empower to do research. Okay? Thank you and good day.